The peri area for my patient was previously cleaned and assessed. So now I'm going to go into my patient's room. Knock, knock. Hello, my name's Keisha. I'm your student nurse today, and I'll be inserting your Foley catheter. It's a catheter that's going to go in through your urethra into your bladder. Can you state your name and date of birth? Okay, Miss Jones. Do you have any known allergies or anything like that? No? Okay, I'm going to keep the curtain closed for privacy and wash my hands. I'm going to raise the bed to a comfortable working height and lower the side rail. Next, I'm going to apply some clean gloves. Okay, Ms. Johnson, I'm going to lift up your blanket for a minute. Can you open your legs for me? Okay. Thank you. Just let them fall and try to relax. Next, I'm going to set up my sterile field. Gotta get face pad, open it, gotta put it under my patient. Okay. And this napkin I will use later. Next I'm gonna remove my sterile gloves, my clean gloves, throw them away, and perform hand hygiene. Next, I'm going to put on my sterile gloves. Okay, I have my sterile gloves on. I'm going to set up my supplies. I'm going to move my kit closer to my patient. Okay. I'm going to open up my betadine, move it around. How are you doing, Miss Jones? Put that in the trash. Put that there. Squirt out my lubricant. This is going to be used later for my urine specimen. I'm going to take a syringe and attach it to my catheter. And I'm going to place my catheter in the lubricant. Okay, Miss Jones, I'm going to touch you. Just spread open. Okay, I'm going to clean you with the betadine. Clean the outside. And throw that away. down the middle and throw that away. How are you doing, Ms. Johnson? Next, I'm going to insert your catheter, so you may feel some pressure. Have you lube it up. Ms. Johnson, can you take a deep breath for me? And on the count of 3, I'm going to insert it. 1, 2, 3. And once I've seen some urine, I'm going to insert it an inch more. Okay, I'm going to hold on to that. I'm going to insert 10 milliliters of normal saline water to inflate the balloon. I'm going to twist that off and tug it a bit to make sure that's in the proper position. Okay, next I'm going to remove these gloves. Throw them away and apply clean gloves. How are you doing, Ms. Johnson? You doing okay? Go to clean the excess betadine away from Ms. Johnson's hairy area. And I'm going to throw that away. Hang the catheter bag. And making sure not to hang it on the side rail. That. Next I'm going to tape I would tape this with some actual tape to Mrs. Johnson's leg. That was just a substitute because I currently didn't have any tape. I would use actual tape. And then cover up Miss Johnson, raise her side rail, and clean up my area. And I throw all this away. I'm going to lower Miss Johnson's bed and give her her call light. Johnson's, if you need anything, just call us. Okay. And then I would document that I inserted 10 milliliters of normal saline into the catheter, that I use a 14 French catheter, and the amount of urine, the color, the clarity, and the odor. And I also document how well Ms. Johnson tolerated the procedure. Okay, and then I'm going to remove these gloves and perform hand hygiene. And next I'm going to remove the catheter. So I would start over, knock knock, gather my supplies first. Gather my supplies, have my syringe, have that, and I would have a napkin and 2 pairs of clean gloves. So I would come in, knock knock. Hello, my name is Keisha, your student nurse, and I will be removing your Foley catheter today. Can you tell me your name and date of birth? Do you have any allergies? Okay. So I'm going to raise your bed to a comfortable working height, wash my hands, lower the side rail, and apply clean gloves. red bag, ready to go. Okay, Ms. Johnson, I'm going to uncover you a bit. So first I'm going to remove the tape and then take my syringe and deflate the balloon. Take that off. Just throw that in the proper area. And I'm going to take a napkin and remove the catheter. On the count of 3, Ms. Johnson, I'm going to remove the catheter. Okay, 1, 2, 3. Okay, I'm going to temporarily put that in the red bag. And then, temporarily put this in the red bag. Then with another napkin, I would clean Mrs. Johnson's peri area and cover her up. And I'm going to remove these gloves, throw them away, raise the side rail, and lower the bed. Then I'm going to put on another pair of clean gloves and remove the catheter bag to the bathroom so I could dispose of it and measure it properly. So I'm going to take this and take this off. And while I did this, I would obtain my urine specimen. And I would take this into the bathroom, dispose of it properly, obtain my urine specimen, and throw that away. And then after that, I would remove my clean gloves and perform hand hygiene. Then I would document that how well Ms. Johnson tolerated the procedure, the size of catheter that I removed, the amount of fluid that I removed, and the color, odor, or any discrepancies. And that is it.